Disclaimer: this podcast is for educational purposes only and is not medical advice. Peptides like ARA290 are still being studied. Always consult a qualified healthcare provider before making changes to your health routine. Today we are diving into ARA290, a synthetic peptide with fascinating potential in the fields of inflammation, nerve protection, and chronic disease management. This peptide is sometimes referred to as cibinetide. It was designed to mimic certain effects of erythropoietin, the hormone best known for stimulating red blood cell production. Unlike erythropoietin, however, ARA290 does not raise red blood cell counts. Instead, it was engineered to selectively trigger tissue protective pathways without increasing risks like blood clots or high blood pressure. The discovery came from understanding how erythropoietin binds to receptors. Researchers found that the classic receptor controls red blood cell production, but there is also a different receptor complex, sometimes called the innate repair receptor, that influences tissue protection and healing. By designing a smaller peptide sequence, scientists were able to target this protective receptor without stimulating the red blood cell pathway. That is where ARA290 comes in. One of the most promising areas of research has been in neuropathic pain. Chronic pain that stems from nerve damage is difficult to treat. Conventional medications like opioids, anticonvulsants, or antidepressants often come with heavy side effects or limited relief. ARA290 has been studied in animal models and human trials for conditions like small fiber neuropathy, often linked to diabetes or sarcoidosis. In some trials, patients reported meaningful improvements in pain and sensory function with good safety outcomes. Beyond pain, ARA290 has been explored for inflammatory and autoimmune disorders. By modulating the innate repair receptor, it appears to reduce damaging inflammatory cascades while encouraging tissue repair. In sarcoidosis patients with small fiber neuropathy, for example, results indicated improvements not just in pain but in nerve density and quality of life. This suggests that the peptide may help regenerate or restore function rather than just masking symptoms. Let's take a closer look at mechanism. ARA290 binds to the innate repair receptor, a heteromer made of the erythropoietin receptor and CD130 subunit. When this receptor is activated, it sets off signaling that protects cells from oxidative stress, limits apoptosis, reduces pro-inflammatory cytokines, and supports regeneration. What's unique is that it leaves behind the erythropoietic effects, avoiding issues like polycythemia. That separation of functions is what makes it such a breakthrough design. Animal studies have shown benefits in models of stroke, traumatic brain injury, kidney disease, and even retinal disorders. In each case, the peptide helped reduce inflammation and cellular death while promoting functional recovery. For example, in diabetic neuropathy models, ARA290 improved nerve conduction and sensitivity. In retinal degeneration models, it preserved vision. These results created enthusiasm for expanding human trials. When it comes to safety, ARA290 appears well tolerated. Clinical studies so far have not shown major adverse effects. Because it does not increase hematocrit or hemoglobin, it avoids the clotting risk of erythropoietin. Dosing strategies in studies have varied, often involving subcutaneous injections. Some trials looked at daily administration, while others used multiple doses per week. Typical study doses range from 1 to 4 milligrams, though this depends on the protocol. In human subjects, benefits seem most pronounced in chronic pain tied to nerve injury. For example, in sarcoidosis-associated neuropathy, patients treated with ARA-290 experience reduced pain scores and improved nerve fiber density measured in skin biopsies. These findings support the hypothesis that it can actually help nerves regrow. This is especially exciting because very few therapies are regenerative in this space. Another interesting aspect is that ARA-290 may help with metabolic inflammation. Some data suggest it can improve insulin sensitivity and reduce markers of systemic inflammation. If confirmed, this could expand its use into diabetes and metabolic syndrome. The idea of a single peptide addressing pain, nerve repair, and inflammation is compelling. Researchers have also explored ARA-290 in conditions like multiple sclerosis, kidney injury, and inflammatory eye diseases. In each of these, tissue protection is central. While human trials are limited, preclinical data are strong. Importantly, its design means it does not interact with red blood cell production, so long-term use could be safer than erythropoietin analogs. From a practical standpoint, ARA-290 is not widely available. It remains under investigation, with some clinical trials ongoing. Regulatory approval is still in process, and much of the access right now is through research channels. That said, interest in it has grown in the peptide community because of its unique dual action, reducing inflammation and supporting regeneration. To better understand its potential, it helps to compare it with other peptides. For example, BPC-157 and TB-500 are also known for tissue repair. However, they act more locally on angiogenesis and collagen repair. ARA-290 works systemically through receptor pathways that coordinate immune and regenerative responses. In that sense, it sits at the intersection of anti-inflammatory peptides and neuroprotective agents. Imagine a future where a patient with diabetic neuropathy could receive a peptide that not only lowers pain but also restores nerve fibers. Or a stroke patient could have reduced brain tissue loss because a protective peptide was given right after the event. That is the vision behind the development of ARA-290. Of course, more research is needed. Questions remain about optimal dosing, long-term safety, and which patient groups will benefit most. Trials must be larger and longer to confirm what early data suggest. Still, the concept of separating tissue protective pathways from red blood cell production is a major scientific achievement. It shows how peptide engineering can unlock highly targeted therapeutic strategies. If you are interested in this peptide, keep an eye on clinical trial announcements. Medical literature continues to publish updates, and some biotech companies are pushing it forward for specific indications. Always remember that it is still investigational. Do not attempt to self-administer research-grade material without medical oversight. Disclaimer: this content is for informational purposes only and should not be taken as medical advice. Always consult a licensed healthcare provider before making decisions about peptides or therapies. Thanks for listening, keep learning, and stay curious.